Okay, and here's the speech Too Much of a Good Thing.
In this speech, the speaker uses the organizational pattern called problem-solution. A problem is explained in the and then a solution is offered in the second half.
There's an old saying that I'm sure many of you out there have heard. Too much of a good thing is wonderful. Now, is this true? The newsletter Harvard Woman's Health Watch published a story about a young woman who went sailing one Friday afternoon. Now, while she was sailing, she sustained a back injury that caused her a lot of pain. And over the course of the next 3 days, she began to take a pain medication called acetaminophen. Now, this is a very common pain medication, most commonly known as Tylenol. Not only did she take this medication, but she also took twice the recommended dosage of it. And 4 days later, she died on the way to the hospital due to liver failure. Apparently, she did not know that taking too much pain medication can cause liver failure and sometimes death. This same newsletter, Harvard Women's Health Watch, estimates that overdoses of pain medication cause 56,000 visits to the emergency room every year, as well as 458 deaths. It is a common trap to think that if a little bit of something is good, then a great deal of it is even better. I'm here today to tell you that too much of a good thing can sometimes be bad for you. Let's start by looking at the problem a little bit more closely. Many people are unaware of the dangers of taking excessive amounts of medicines and supplements. For example, the popular sleep aid Ambien, if you take the recommended dose, it'll make you drowsy so that you can go to sleep. So taking more will just make you go to sleep faster, right? That may be so, but it can also lead to a reduction in breathing, coma, and even death. This information is according to Dr. Daniel F. Kripke, the professor of psychiatry at the University of California at San Diego, who is the author of The Dark Side of Sleeping Pills. The General Practitioner medical journal says that taking too much ibuprofen, which is another very common pain medication, most commonly known as Advil, can cause gastrointestinal bleeding within just 3 days of overuse. Dr. Bill Edwards, the director of inpatient care at the Children's Hospital in Peoria, Illinois, tells the story of a child who displayed symptoms of a brain tumor. This includes dizziness, pressure in the head, headache, blurry vision. These are all symptoms of a brain tumor, but tests reported no brain tumor. After further testing, they did discover that this child had an overdose of vitamin A. Can vitamins be toxic? The answer is yes, if they are taken in large amounts. According to Dr. Joshua Hamilton, professor of toxicology at Dartmouth College, an excess use of vitamin B6 can cause nerve damage to the arms and legs. An excess use of vitamin C can cause kidney stones. And an excess use of vitamin D can cause damage to the kidneys. Now that we've examined the problem, what's the solution? It's important to be cautious and well informed. Collaborate with doctors on what pills and supplements and vitamins you should be taking. Always take the recommended dosage, never more. Be aware of complications, because even though you might be taking the recommended dosage, there could still be toxic interactions with the medications that you are taking. Try making a list of all the vitamins and medications that you're taking and show them to your doctor or your pharmacist to make sure that there aren't any toxic interactions. Educate yourself by consulting health books or health magazines and newsletters. Another good source of education is the internet, but you've got to be very careful with that. Only use reputable sources such as the health sections in abc.com, msnbc.com, or cbs.com. Dr. Kathy Kemper, the author of The Holistic Pediatrician, warns against using common search engines such as Google. Now, the reason for that is this. Remember the child who had an overdose of vitamin A? Well, his parents were influenced by a website claiming that vitamin A was a cure for children who were hyperactive and had trouble concentrating in school. So you can see where getting the wrong information can be very harmful to you and your children. These web searches turn out hundreds of sites that they talk about vitamin A or any other medication or supplement that you might be investigating, but these sites are also dedicated to selling a product, so you can't trust them to be objective. So let's sum up what we've talked about today. Painkillers and vitamins are good for you, but they can be harmful when taken in excessive amounts. Collaborate with doctors and pharmacists to know what supplements and what medications you should and shouldn't be taking. Always stay within the recommended dosage, never more. Keep yourself informed by consulting books and magazines and reliable web pages. So, now that you've seen that you can't always accept the old saying, too much of a good thing is wonderful, maybe you'll agree that there's another old saying that offers some better advice. Too much of a good thing can be awful. Are there any questions? Yes.
Okay, and here are the critical thinking questions. I would add to that one, is it effective? Why or why not? And once again, is the organization effective? Why or why not? Another question I would add is, she has the one visual aid at the end, but nothing else. Do you think other visual aids would have helped her? What kind of visual aids would you suggest?